Have you ever wondered if the pills you've been taking for years might be doing more harm than good, especially to your heart? I know that for many of you, taking medications has just become a normal part of daily life. And when a doctor prescribes something, you trust it's for your health. But what if I told you that some of the most commonly used pills, ones sitting in your medicine cabinet right now, could be quietly putting your heart at risk? As someone who's spent decades in the field of heart health, I've seen so many seniors come in with shortness of breath, chest discomfort, or sudden tiredness. And often, it's not just age or stress causing it. It's the medications they've been taking faithfully for years, without ever being warned about the hidden risks. In the next few minutes, I'm going to walk you through the 7 pills most likely to damage your heart if you're over 60. And no, this isn't meant to scare you, but to help you make smarter choices. Because when it comes to your heart, you can't afford to ignore the signs. So stick with me, and by the end, I want to know, which one of these surprised you the most? Leave a comment and let me know. You might just help someone else catch something early too. Pill number 1. Non-steroidal anti-inflammatory drugs. Let's talk about something you probably have in your cabinet right now: ibuprofen, Advil, Motrin, Aleve, maybe even high-dose aspirin. These are called NSAIDs, short for non-steroidal anti-inflammatory drugs. And listen, I get it. When your joints ache, your back hurts, or arthritis flares up, these pills feel like a lifesaver. But here's what most people over 60 don't realize. These same pills can quietly put pressure on your heart in ways that build up over time. Here's how it happens. These medications cause your body to hold on to more sodium and water. That might not sound like a big deal, but that extra fluid makes your heart work harder. Imagine your heart trying to pump against a rising tide. If your heart's already aging, or if you've had high blood pressure or heart issues in the past, this extra strain can be dangerous. We're talking about increased risk for things like heart failure, irregular heartbeat, or even kidney problems. What's worse is that many folks take these daily, thinking they're safe just because they're sold over the counter. But safe for a 30-year-old isn't always safe for someone in their 60s or 70s. And often, the damage is silent. You don't feel it happening until it's already done. Now, I'm not saying you should suffer in pain. There are safer options out there, like acetaminophen, Tylenol, physical therapy, or even certain topical treatments that don't affect your heart the same way. The key is talking to your doctor before making NSAIDs a daily habit. You deserve pain relief, but not at the cost of your heart. And if you've been relying on NSAIDs for a while, it's not too late to ask questions and make a change. Pill number 2. Thiazolidinediones. Let's talk about something many of you are familiar with: type 2 diabetes. It's common as we get older, and managing it often means taking daily medications. If you're on drugs like Actos, pioglitazone, or Avandia, rosiglitazone, it's important you listen closely right now, because what I'm about to share could seriously impact your heart health. These drugs belong to a group called thiazolidinediones, or TZDs. On paper, they do a good thing. They help your body respond better to insulin, keeping your blood sugar more stable. But here's the catch. They also cause your body to retain fluid. That means holding on to extra water in places it shouldn't: your ankles, legs, even around your heart. And if your heart is already tired or aging, like most hearts over 60 are, this added pressure can be dangerous. Some of you might already be noticing small signs and not even realize it. Maybe your shoes feel tighter than they used to, or your feet swell up by the end of the day. Maybe walking across the room leaves you more winded than it used to. And let's be honest. It's easy to say, well, I'm just getting older. But what if it's not just age? What if it's your medication, slowly making things worse without you realizing it? Even worse, these symptoms, the swelling, fatigue, shortness of breath, can mask early signs of heart failure, especially in people with diabetes, high blood pressure, or obesity. And that's a dangerous mix. You might feel okay today, but slowly, over months or years, your heart could be taking a beating behind the scenes. Now, I want to be clear. I'm not saying these pills are bad for everyone. But for many older adults, the risks can outweigh the benefits, especially when there are better, safer alternatives today. Medications like metformin have been around for a long time and are considered safer for the heart. Even newer options like SGLT2 inhibitors can actually protect your heart while managing your blood sugar. So, if you're taking a TZD and you're over 60, Especially if you've had heart issues or are noticing changes in your energy, weight, or breathing, it's time for a conversation. Call your doctor. Don't just accept side effects as part of getting old. You deserve to feel strong and supported. Your health is too important to leave on autopilot. One smart question today could save you from bigger trouble tomorrow. Pill number 3. Sleeping pills. If you've ever stared at the ceiling at 2 a.m., you know how frustrating sleep problems can be. And for a lot of older adults, this isn't just the occasional rough night. It becomes a pattern. That's why many people turn to sleeping pills like Ambien, Zolpidem, Lunesta, or even older drugs like Valium, diazepam, to finally get some rest. Now I get it. When you're exhausted, all you want is something that works. And these pills do work, at least in the short term. They help quiet the mind, relax the body, and ease you into sleep. But here's the part most folks don't hear until it's too late. These medications can quietly take a toll on your heart, especially if you're over 60. These drugs work by slowing down your brain and central nervous system. That's how they help you drift off. But when your entire system slows down, including your heart rate, blood pressure, and even your breathing, it can lead to serious issues overnight. One major concern? Sleep apnea. Many people don't even know they have it, but sleeping pills can make it worse. And when your breathing pauses throughout the night, your heart is forced to work harder to compensate. That kind of stress, night after night, adds up. It can lead to irregular heartbeats, high blood pressure, or even heart failure over time. That's not all. Sleeping pills can also interfere with medications you might already be taking for your heart, like beta blockers or calcium channel blockers, making them less effective. And then there are the side effects that hit older folks the hardest. Confusion, dizziness, unsteadiness. These can lead to falls, hospital visits, and even more heart strain from the stress on your body. And here's something a lot of people don't think about. Over time, these medications can also affect your memory and mental sharpness. And when that starts to slip, managing your health gets harder. You might forget a dose, double up by mistake, or skip the things that help your heart, like staying active or eating right. So what's the solution? There are safer options. Many older adults see great results with cognitive behavioral therapy for insomnia, CBTI. It's a mouthful, but it basically means working with a trained expert to build healthy sleep habits that last. Relaxation techniques, addressing stress or pain, and creating a consistent bedtime routine can go a long way, all without putting your heart at risk. If you're relying on a sleeping pill night after night, it might be time to talk to your doctor about cutting back or trying something new. You deserve restful sleep, and you deserve to protect your heart, too. Pill number 4. Tricyclic antidepressants. You might recognize some older medications like amitriptyline, nortriptyline, or imipramine. These belong to a group called tricyclic antidepressants, or TCAs. They were commonly used for depression, anxiety, or chronic pain conditions like nerve pain or migraines. While they've helped many, these medications come with some important risks for people over 60, especially when it comes to your heart. TCAs can interfere with the heart's normal electrical signals, which can lead to irregular heartbeats, heart blocks, or sudden changes in blood pressure. If you already have heart issues like a slow heartbeat or atrial fibrillation, these drugs can make things worse even when taken at low doses. Over time, using TCAs might increase your chances of serious heart problems. Besides affecting the heart, these medicines can cause dizziness, make your blood pressure drop suddenly when you stand up, which can lead to falls, and make you feel very sleepy or groggy. For older adults, these side effects can be dangerous, because falling can lead to injuries that only add to health problems. Despite these risks, some doctors still prescribe TCAs because they're cheaper or more familiar than newer drugs. But today, there are safer options like SSRIs or SNRIs, which usually have fewer effects on the heart. If you're taking one of these older antidepressants and notice symptoms like your heart racing or fluttering, feeling dizzy, or getting tired more easily, don't wait. Talk to your doctor right away. Regular checkups and honest conversations about switching medications can help keep your heart safe while still treating your mental health or pain. If you're still with me and finding this helpful, drop a comment with the number 2. I'd love to know you're following along. Pill number 5. Decongestants like pseudoephedrine and phenylephrine. A lot of seniors reach for over-the-counter cold and allergy meds that contain decongestants such as pseudoephedrine or phenylephrine to clear up stuffy noses or sinus pressure. They might feel like a quick relief, especially during allergy season or when battling a cold. But here's the thing, these drugs can actually be risky for your heart, especially if you're over 60. Decongestants work by tightening the blood vessels in your nose to reduce swelling and congestion. The problem is, they don't just affect your nose. They tighten blood vessels all over your body, including those near your heart. This can cause your blood pressure to go up and your heart to beat faster, putting extra strain on your heart muscle. If you already have high blood pressure, heart disease, or other heart concerns, this extra stress can lead to serious issues like heart palpitations, irregular heartbeats, or even heart attacks. Some side effects like feeling jittery, anxious, or dizzy are actually signs that your heart might be struggling. Because our bodies change as we age, like stiffer blood vessels and slower kidney function, these effects can hit harder than you might expect. Just because a medication is sold over the counter doesn't mean it's completely safe for everyone, especially seniors. To stay safe, make sure to check your medicine labels carefully and try to avoid products with pseudoephedrine or phenylephrine if you have heart problems or high blood pressure. There are safer options like saline sprays, steam inhalation, or certain antihistamines that can help with congestion and allergies without putting your heart at risk. Always talk with your doctor or pharmacist before taking any decongestants, especially if you're on other medications or have a heart condition. Protecting your heart is worth the extra caution. Pill number 6. Proton pump inhibitors. Many seniors use proton pump inhibitors. Proton pump inhibitors like omeprazole, pantoprazole, or esomeprazole to manage acid reflux, heartburn, or GERD. These meds are very common and often seen as a safe, long-term fix. But recent research shows that taking them for a long time can quietly cause serious problems for your heart, especially if you're over 60. Proton pump inhibitors work by lowering the amount of stomach acid you produce, which helps ease that burning feeling and protects your esophagus from damage. While they're great for short-term relief, reducing stomach acid over a long time can mess with how your body absorbs important nutrients, magnesium being one of the most important. Magnesium plays a big role in keeping your heart beating regularly, your muscles working properly, and your energy up. If your magnesium levels drop too low, it can cause dangerous issues like irregular heartbeats, fatigue, muscle weakness, and in serious cases, even seizures. But the risks don't stop there. Long-term use of proton pump inhibitors can also disrupt the balance of good bacteria in your gut, which may lead to inflammation throughout your body. This inflammation can contribute to clogged arteries and increase your risk for heart disease. Studies have even linked extended proton pump inhibitors use with a higher chance of heart attacks and strokes, especially in seniors who might already have heart problems or other risk factors like high blood pressure or diabetes. If you've been on PPIs for weeks or months, it's important to talk with your doctor about whether you still need them. Sometimes, lifestyle changes like avoiding spicy or acidic foods, eating smaller meals, and managing your weight can help control reflux and reduce the need for medication. When proton pump inhibitors are necessary, your doctor should monitor your magnesium levels regularly and try to use the lowest dose possible for the shortest time needed. There are also alternative treatments like H2 blockers or antacids, which might be safer options for some people. Remember, protecting your heart means tackling the root causes of acid reflux, not just masking symptoms with meds that could quietly harm your heart over time. If you're still watching and finding this useful, please drop a comment below with the number 6. I'd love to know you're still with me. Pill number 7. Calcium channel blockers and their impact on seniors. Calcium channel blockers, CCBs, are commonly prescribed medications for seniors to manage issues like high blood pressure, chest pain, angina, and irregular heart rhythms. Drugs such as verapamil, diltiazem, nifedipine, and amlodipine fall into this category and are widely used. These medications help by preventing calcium from entering the heart and blood vessel muscles, which relaxes and widens blood vessels. This improves blood flow, lowers blood pressure, and can ease chest pain. They also help regulate heart rhythm in some cases. However, certain older types of CCBs, especially verapamil and diltiazem, can cause some serious side effects, particularly in seniors. As people age, their heart and kidney functions naturally decline, and taking multiple medications increases the chances of unwanted effects. Main concerns for seniors taking CCBs include 1. Slow heart rate. Bradycardia. Some CCBs can reduce the heart rate too much, causing dizziness, fainting, extreme tiredness, and increasing the risk of falls. In severe cases, this might lead to heart block, which could require a pacemaker. 2. Fluid retention and swelling. Drugs like nifedipine and amlodipine may cause swelling in the legs and ankles due to fluid buildup. This can make moving around harder and increase the risk of infections or breathing difficulties. 3. Drug interactions. Seniors often take several medications, raising the risk of interactions. For example, verapamil and diltiazem can affect how cholesterol medicines, statins, work, increasing the chance of muscle pain or serious muscle breakdown. They can also interact with beta blockers, making heart rate or blood pressure drop too low. 4. Misinterpreting side effects. Fatigue, dizziness, or swelling might be wrongly attributed to normal aging rather than medication side effects. This can delay needed medical attention. Tips for seniors on calcium channel blockers. Regularly monitor heart rate, blood pressure, kidney function, and electrolytes like potassium and magnesium. Report symptoms like dizziness, swelling, fainting, or shortness of breath to your healthcare provider right away. Discuss safer alternatives with your doctor. Newer CCBs such as amlodipine often have fewer side effects than older ones like verapamil. Never stop taking CCBs suddenly without medical advice, as this can cause dangerous spikes in blood pressure or chest pain. Calcium channel blockers can be life-saving but require careful use and regular checkups to ensure they remain safe and effective for seniors. If you found this information helpful, please share your key takeaway in the comments below and tell us how you plan to apply it in your life. Your experience could encourage others. Don't forget to like, share, and subscribe for more health tips tailored to seniors. Stay informed, stay heart healthy, and take charge of your wellness.